Right. I'm in there. Oh, she recorded it.
Good afternoon, everyone. Thank you for joining us today. If you aren't, please mute yourself to ensure that we don't have any background noise as we're um, developing this webinar and presenting this webinar. So I'll give you a chance to mute yourself. We are recording this webinar. Just want to confirm everyone can see my screen.
Yes.
Good to go. Thank you. Okay, good. Well, welcome to the introduction of the Kansas Home and Community-Based Supporting Organization, ADRC, Assessing Organization, ACM. My name is Megan Shepard. I'm the Policy and Program Oversight Director here at KDADS. And we are presenting this webinar to you regarding some changes that we've had in our contracts for the ADRC, Assessing Entity, and ACM. And we're going to go over those today. And, you know, just like KDHE had CanCare change in contractors, we also had a change in contractors with the services that we provide for the assessing and the ADRC. And I hope that today's webinar helps answer some questions that you've all have had and provides additional information to you all. And with that, I will go ahead and kick it off. Excuse me, why? So for the agenda, we're going to meet the organizers, the supporting organization, do a waiver overflow and a high-level workflow, and then I hope we have time to get to questions. And like I said before, the goal is really to center all this around the participant and the family caregiver. KDADS in partnership with KDHE, ADRC, Assessing Org, the MCO, ACM, and other community organizations. We really want to provide the best services to Kansans in our region and be able to get you the services that you need timely and in the way that is needed. So with that, I'm going to hand it over to our partners at ADRC with Liberty. Is that you, Priska?
It is. I just turning off my mute. Hi, everyone. My name is Priska Asaro, and I'm the Executive Director for the Kansas ADRC, which is supported by Liberty Healthcare. I don't know if we need to go to the next slide. There you go. Thank you. So Liberty Healthcare, we are new to Kansas, but we support many programs throughout the United States, specializing in IDD support, aging and disability, and behavioral health. So we have over 38 years of experience in community outreach. We're familiar with options counseling and referrals. Collaborating with our stakeholders is something that I enjoy. And then, of course, data-driven decision-making to ensure improvement and participant outcomes are all positive. Altogether, reviewing processes to look for efficiency. And like Megan said, making sure that the less time spent to provide services and support to our community is top of mind. Next slide. So our mission and our purpose is to create and deploy a person-centered process. I won't read this word for word, but it included in the person-centered is to ensure that their environment and those that are caring for them are also supported. So we want to make sure that the person themselves is able to live independently and to thrive in their home, but we want to make sure that they have the support is also provided to the caregivers. So by focusing on the data-driven insights, to improve our process, to increase the benefit of experiences, to utilize the evidence-based best practice standards, and improving access to services, which I'll speak to here in just a second. And then, of course, we want to achieve this in a cost-effective, sustainable.
Hi, what is that?
Next slide, please.
It's close, but it doesn't fit any of our people.
Are you just going to donate?
We're gonna
Just make sure that you're muted, because we're hearing some conversations. So what I'd like to do is just have everyone meet our team. So we have a team of options counselors, and they have a wide range of backgrounds and expertise. Also a few that have actually lived the experience and have used the services of the state of Kansas that we provide. Our staff is trained in trauma-informed care and motivational interviewing, so that we can provide stable and knowledgeable access to all of the support and resources that we have, and assist in navigating through this. We also have 2 of our staff who are also bilingual, so we're able to provide resources to many communities of any language, but immediately we can assist those that speak Spanish. Next slide, please. So the leadership, of course, I introduced myself, and I have Harold Morales, who is one of our lead options counselors. He is certified in medical translation and is able to provide the same care for those folks that don't speak English. And then we also have Erin Davis, who is another lead options counselor. She manages the central and western regions of Kansas, and has over 10 years experience in ADRC. Harold covers the eastern regions, and then of course I oversee and support the entire team. Next slide, please. In our eastern region, we have Amy Huffman. She is our East Central Region options counselor. We have Erin Schlosshauer. She is from the East Central Region as well. Grace Hunter is from the Northeastern Region. Hannah McNeil is Northeastern Region. Jamie Brion is Northeastern Region. And Patrick Lightcamp, one of our newest, is the Southeastern Region. And we also have Candace Stevens, who is a PRN, part-time options counselor. Next slide, please. For our Central and Western Region team, we have Braylon, who is South Central Region. Callista is our Southwestern Region. James is Central and Northwest Region. Jenny is Central, South Central, and Northwest Regions. Martin is South Central. Paige is Southwestern. And of course, we have another PRN options counselor. And I felt that it was important to introduce you to the team and have their pictures and show you their locations, because we will be and have been out in the community. And it's always good to see who the community is speaking with. All of them have either degrees with aging and development, as well as those living with disabilities. So we have a pretty good team across the state of Kansas. Next slide, please. So our role and our purpose really hasn't changed much from how it's been. We want to be the resource for older adults and those living with disabilities in Kansas. And we're going to focus on meeting people where they live, work, and socialize. We also utilize a no wrong door system. We want to be able to be the one call that they make, and so that we can refer them and provide assistance when they don't know where else to go for answers, or they're unfamiliar with some of the other programs. We do provide options counseling that empowers people to make informed decisions about their long-term services and support, and help them access public and private programs. So when I talk about meeting people where they live and they work, so they can call our toll-free number, which is the same ADRC number that has been around for many years. They can go to our website, that information will be provided on another slide. Fill out a form, and we can contact. That goes for not just community members, but also some of our partners out in the community. And we will meet and make appointments to meet folks in their home, in the hospital setting, wherever it is that's easier for them. We also have our office in Lawrence, Kansas, and we can have folks come and visit with us, either walk in or via appointment. That's going to make best sense for them. If need be, we can also provide access to our options counselors and information via a virtual call, whether it's Zoom or Teams. We understand we have many families that are spread out not only across Kansas, but they may have family outside of Kansas that choose to be part of the conversation. So we welcome that, and we like to make it easier for them to be able to have that family, that caregiving network around them as they make their decisions. Next slide, please. Again, since we've made this transition, there have been calls going back and forth. So we wanted to make sure that folks knew which number to call or which organization to call. And of course, our resource center provides assistance tailored to each unique situation and guidance. We do referrals for assessments, and we answer any questions that they may have. And our wonderful area agencies on aging within Kansas, regionally, also provide a wide range of services. So this list is not all inclusive of all the great things they do in their communities, but just as examples, senior nutrition programs, caregiver support, legal assistance, and in-home services, provide many community-based programs that may not be available statewide, but we can certainly reach out to our area agencies on aging for those special programs that they have. Next slide, please. Like I said, we provide information referral and assistance and options counseling. So just making sure that folks are aware and know how to access, to reach out to, and get involved in some of the support services that we have. We provide long-term support needs for people. And like I said, just identifying the resources, reducing any confusion, on this with the information that they have, and making sure that they are connected to the right person, to the right organization, so that they can have their needs supported as soon as possible. Next slide. So our ADR services, like I said, there's several different ways to contact us. For those that do require an assessment, we will, upon the completion of an options counseling, if that's needed, we'll send the referral off for an assessment. We will also provide more information on other services to make sure that the person is cared for during the assessment process, during the waiver process, and of course to ensure that they have some resources should they be put on a waiting list for some reason. We do follow up with the community members to make sure that they were able to access and speak to someone, and then we want to complete the contact. It's not always completed in one day. It may take a week or two just to make sure that they receive the right information and the right services. Next slide, please. So like I discussed, we have the ADRC number. Our office at 5020 Bob Billings Parkway is in Lawrence. We have online inquiry through our website. And then, of course, they can email us directly, and we can answer any questions, not just for the community members, but also our partners and other organizations within the state. Next slide, please. Thank you so much for your time, and I'm very open and willing to answer any questions that you may have after this. And as I said, you start with the ADRC and we pass it on to the assessment. So Maximus.
Thank you, Priska. Hi, my name is Stephanie Burkhead. I work in community outreach at Maximus, the new assessing organization. Next slide, please. So Maximus is the new statewide assessing organization for 3 of the HCBS waivers and the PACE program. We're a government contractor who provides strategic support services to different states across the country. We bring 24 years of experience conducting independent assessments and about 30 years of experience working in the state of Kansas. As an independent assessing agency, we serve diverse communities, always providing quality assurance and person-centered technical assistance. Next slide, please. Within our clinical services division, we actually manage contracts in 23 different states, all of which have large-scale programs similar to what we're doing in Kansas. I won't go into depth in any of those, but if you ever wanted more information, you could always visit our website to learn more. Next website, or excuse me, next slide, please. Our program staff, almost all of whom are pictured here are on the call, is led by our managing director, Joanna Morgan, a program director, Paul Cook, and a program manager, Julie Cooper, and then 4 clinical supervisors, one of whom is not pictured here because she is new to our organization, Sam Filburn, Amy Weedle, Megan Alvis, and Letha Farwell. They oversee a team of about 40 assessors who are spread throughout the entire state of Kansas. And then I specifically work dedicated to community outreach for our partner organizations, participants, and caregivers on behalf of Maximus. Next slide. So what is an assessing organization? Those of you who are currently on waivers or caring for someone currently on a waiver already know, but for anyone new, an assessing organization is an independent contractor of the state. So Maximus has been hired as a third-party vendor to conduct functional eligibility assessments for the brain injury, frail elderly, and physical disability waivers, as well as the program of all-inclusive care for the elderly, or the PACE program. Our goal as the assessing organization is to streamline the process of obtaining HCBS waiver services. Next slide, please. What you or a loved one can expect during an assessment are individuals who come into your home or a community setting with the intention of collaborating with you, using their interpersonal skills and oftentimes existing clinical backgrounds to provide timely and efficient evaluations informed by trainings in trauma-backed approaches and cultural competency. We've found that approach results in increased satisfaction since our service is person-focused. Our approach is very similar to what you heard from Priska with the ADRC options counseling as well. Next slide. As Megan mentioned in the very beginning, we do not do this work alone. We partner with organizations on this call and many others across the state to support Kansans in need of assistance. So some of these key partners you may have worked with already. They include the managed care organizations, of which there are 3 who support the state of Kansas, 11 different area agencies on aging, several different centers for independent living spread throughout the state, and 3 PACE providers, but many others who are not pictured here. And next, I will turn it over to one of those key partners to discuss their role in administrative case management.
Hi, I'm Tammy with the Northwest Kansas Area Agency on Aging. Administrative case management is a service offered by the 11 Kansas Area Agencies on Aging, and the Northwest Kansas Area Agency on Aging is the prime contractor. Next slide, please. This map shows each area agency on aging service area. There are 11 of them in the state of Kansas. The next slide lets us know what an area agency on aging is. We're the local leaders and aging experts serving older Kansans and caregivers in all 105 Kansas counties. Area agencies on aging were created by 1973 amendments to the Older Americans Act. For over 50 years, an area agency on aging programs and services have helped older Kansans and their caregivers by coordinating cost-effective services and supports. Next slide, please. The next handout shows what handout we will leave with the case managers, with the individuals at the time of their eligibility assessments completed so they can contract the administrative case manager for assistance, a map with the contact information that was shown on the previous slide for each area agency on aging will also be attached so the individual has contact information to reach out to the person that they're looking for. Next slide, please. Administrative case management consists of 3 components: intake, Medicaid application assistance, and liaison services. After the functional eligibility assessment is completed, the functional assessor will offer administrative case management to the individual. The individual must accept or decline administrative case management services. There are numerous ways to initiate a request for administrative case management services. It can be from the client, a request from their caregiver or legal representative, referrals from partner agencies like Liberty Health or Maximus. Individuals who utilize the work program can also access administrative case management services. We can help with initial and annual Medicaid application assistance. Becoming financially eligible for Medicaid can be a confusing process for individuals and their caregivers. Administrative case managers also act as liaisons between the numerous entities involved in the Medicaid eligibility process. Next slide, please. When an individual accepts administrative case management services, the administrative case manager will contact the individual and discuss whether a new Medicaid application is needed, if the individual has started an application but needs help obtaining and submitting additional documents, or if the individual just wants help in the future with their annual renewal. The administrative case manager will develop a checklist of necessary documents specific to the individual's unique application and will complete a release of information specific to those entities for the individual or their legal representative to sign. Oftentimes, documents are needed from banks, funeral or burial plans, and pension plans. The administrative case manager can also assist with obtaining documentation to support initial programmatic eligibility for individuals seeking services on the HCBS Braille Elderly, Physical Disability, Brain Injury waivers for the PACE program. In addition, the administrative case manager can assist with obtaining supporting documentation for crisis exception requests, for waivers with wait lists, or for the Social Security disability application. Administrative case management assistance can be provided at any time during the individual's 365-day functional eligibility period. Next slide, please. This slide makes several references to KDH&E, which is the Kansas Department of Health and Environment. Some people refer to this entity as the CanCare Clearinghouse, as correspondence received regarding the Medicaid application has both names on it. For this presentation, I'll refer to the organization that processes Medicaid applications as KDHE. When the individual lists the administrative case management entity as a facilitator with KDHE, the administrative case manager will also receive notices and updates from KDHE. The individual or their legal representative must sign the forms that are submitted to KDHE. The administrative case manager will submit the completed Medicaid application to KDHE electronically or by fax and will confirm that the application was received. The administrative case management entity will monitor and provide updates to the individual throughout the application process. Most of these updates will provide clarification about communication from KDHE requesting additional information or the eligibility determination. Annual assistance for Medicaid financial eligibility is available. The administrative case manager will also contact the individual when the renewal is due. And after KDHE makes a determination, the administrative case manager will contact the individual to complete a short survey. And next slide, please. It's important to remember that administrative case managers do not make programmatic eligibility determinations, speculations, or provide advice. Administrative case managers are able to complete the Medicaid application or renewal and submit the application timely to KDHE, so each individual can determine if Medicaid is a favorable option for their needs and financial situation. Administrative case managers are able to accept referrals from individuals and their caregivers or legal representatives or partner agencies such as Liberty Healthcare or Maximus at any time during the individual's 365-day functional eligibility period, because their ultimate goal is to make sure that everyone who needs help gets help.
Excuse me. We have a couple of people having difficulty understanding. Could you maybe slow down a little bit?
Where do you need me to go back to?
I couldn't say. I just see people in the chat saying they're having trouble. Slow down and get closer to the mic.
If there are specific questions, they can ask them at the end and I'll be happy to answer them since I'm not sure exactly where the problem was at with the electronic device.
Okay.
I'll be happy to pick up here to provide a little bit of an overview of the home and community-based services, or HCBS, which you've heard repeated throughout this presentation, and the supporting organizations. Next slide, please. So the goal of HCBS programs is to help individuals with disabilities to stay in their home or community as long as they choose. KDADS not only oversees the organizations you're hearing from on this call, they also oversee a large network of providers who offer the services through the HCBS programs. We'll talk about the role of KDADS and KDHE, the Kansas Department of Health and Environment, at the end, but it's important to note, as Tammy just did, that KDADS provides waiver program and functional eligibility determination, and KDHE makes the ultimate financial eligibility determination. So neither Liberty nor Maximus nor the Northwest Kansas AAA provide any final eligibility determinations for individuals. Next slide, please. What the ADRC provides to Kansans is, as you heard from Priska, a person-centered approach that supports making informed choices about long-term services and supports. They also provide access to essential community programs and services. They are working to increase the visibility of resources and supports available, and they provide objective, accurate information and assistance. Next slide. Similarly, Maximus is the assessing organization, provides experienced staff with clinical and/or training backgrounds, Medicaid, HCBS, and program-specific trainings from KDHE and KDAD staff, cooperation with other state agencies and organizations, and overall general respect and consideration for individuals of various backgrounds and experiences. Next slide, please. The AAAs also support older adults across the entire state of Kansas. As you heard from Tammy, they provide assistance with all Medicaid-related documentation. They help individuals and their family members understand all components of the Medicaid program and provide support for maintaining their overall Medicaid eligibility. Next slide. All right. So, and actually we can go to the next slide. At a high level, a participant applies for an HCBS waiver. As you have already heard, they will first go to the ADRC for options counseling, which you heard from Priska. Then a referral gets sent to Maximus to conduct the functional eligibility assessment. After which a referral may or may not be sent to the AAA for administrative case management, depending upon the participant's preferences. Behind the scenes, KDADS and KDHE coordinate the overall program, and when approved, the participant receives their services and supports. Next slide. Priska, would you like to speak to this?
Yes, thank you. So the options counseling role is where we're going to have a conversation with the community partner and the community member, whoever calls in, talking to them about their life, their care needs, what kind of support that they're looking for, so that we can identify all the long-term care options available to them, which may include a waiver. Not all of them do. The option counselor will review waiver information, like I said, in order to assess whether they need a waiver program would be good for them or if they would qualify with the criteria. And then once we have spoken with the community member and we have identified that a waiver is a good option for them and they've decided that that's the way they wanted to go, we will then refer the assessment over to Maximus so that they can contact the community member in order to go ahead and schedule an assessment. Next slide.
Thanks, Priska. So to give you a greater understanding of the behind the scenes workflow, once Maximus receives a referral from the ADRC for new assessments, we have 5 business days to complete the assessment. We provide what's called a level of care outcome score to KDADS, who reviews the participants' results and supporting documentation before passing it over to KDHE. At the same time, a referral will be sent to the AAAs for administrative case management. It's important to call out that there are specific documentation requirements as part of this process. And actually, we'll speak a little bit more about that on the next slide. Thank you. So this is a list of the assessment documentation that is completed, and the assessor, so there's several pieces of information that are required by the state of Kansas. Not all of these will be necessarily filled out with a participant or their caregiver at the time of the assessment. Some of these are a little bit more behind the scenes, but this is just to give you an idea of all the different documentation that's required. So the assessors must have a signed release of information on file in order to conduct the assessment. For brain injury and physical disability waivers, specifically, medical documentation that supports the medical diagnosis is also required. That's a component that the administrative case managers can also help provide. Sometimes this includes copies of medical records, could be certified documentation from a physician, or other documents showing that a medical diagnosis has been made. The assessors use a tool called a functional assessment inventory, or FAI, if you ever see that noted anywhere, which is used for the PACE program assessments and the physical disability and frail elderly waivers. They use a different tool called the Medicaid Functional Eligibility Assessment Inventory for the brain injury waiver. And again, those aren't necessarily pieces of documentation that participants will see, but that's just to give everybody an idea of what our assessors are using. Then for new assessments, if a level of care score is met, the assessor will give the individual what's called a provisional plan of care, or a PPOC, which is services that might be recommended a participant receives if they are able to access a program. But we would also like to note that upon working with a case manager at the managed care organization, or MCO, such as Healthy Blue or Sunflower, or United Healthcare, a more specific individualized plan will be provided once a participant's overall eligibility is confirmed. Next slide, please. So after the assessment, as we just discussed, a participant will receive their level of score sheet that outlines whether or not they met the level of care for functional eligibility. If not, the process for appeals is also provided to the participant, and our assessors leave participants with a sheet that provides instructions on what to do next. Participants and sometimes their caregivers are asked to sign forms, which are necessary to finalize the assessment. Participants are also given the option to complete a post-assessment survey, which is something purely Maximus uses. It's an anonymous survey that we use to collect in our training department for quality improvement purposes. And then participants, of course, can also opt in to receive ACM services. Our assessors use an ACM specific acknowledgement and referral form designating whether or not the individuals would like to opt in to administrative case management, and we send that to the AAA. Next slide. Tammy, would you like to go ahead and speak to this one?
Can help her since she was having a little bit of trouble with it. So after
Perfect.
So after the assessment, Maximus, who's the assessor, would provide the participant with their LOC score sheet. And if they did meet that score, they would let them know what ACM can help them with. And then they would have them sign the referral or acknowledgement form, which simply is, yes, I want help from administrative case management, or no, I think I'm okay and I don't need that help right now. So that form would be sent to the state as part of the functional eligibility assessment. And the participants can either call the AAA to discuss services and the help that we can provide. And a lot of the Maximus assessors have been really good about also emailing us or calling us with the participant just to make sure that referral happens and so that people aren't falling through the cracks. Honestly, we really are trying to work hard to make sure that people who do need help do receive that help and get through this whole process, because we all know how confusing it can be. And so at that point, then the regional area agency on aging does have an administrative case manager that is that point contact for that participant.
Okay, and the role of KDADS and KDHE is next. So KDADS waiver eligibility staff will review both program and functional eligibility. KDADS will provide that outcome based on the review of the program and functional eligibility that was done by Maximus. If the person is both program and functionally eligibility for the waiver, and the waiver does not have a wait list, KDADS will send a waiver access approval form to KDHE for processing. Currently, the only waiver that we have a wait list is the physical disability waiver. If the person is both program and functionally eligible for the waiver, and the waiver has a wait list, KDADS will place the person on the wait list and send that outcome to KDHE for their files. And I should say, for the purpose of this webinar, between FE, BI, and PD, currently the only one we have is physical disability. If the person is neither program and or functionally eligible for the waiver, KDADS denies waiver access, sends the denial to KDHE, and KDHE processes the denial, and the appeal rights are provided.
Do you want me to jump in and speak to next steps, Megan?
Yeah, that'd be great.
All right. So hopefully you have gathered by now that all three of our organizations, I should say all three of the contracted organizations, all of the organizations working with KDADS are committed to outreach and engagement. You may see us or hear about us out at community events, meetings, or conferences around the state. We are prepared in the community and on the phones or over email to answer questions and provide assistance through this process, particularly during this transition. Next slide, please. Maximus specifically currently provides website content on the KDAD site as one tool for providing info about HCBS services. We also support social media, video content, and various guides and documents. We do have a quarterly email distribution list for waiver participants and caregivers, and we have our contact information listed at the end if you would like to join that list to start receiving our email communications. Next slide, please. We are all committed to providing participants keeping participants engaged and informed. So please do visit this website for more information and opportunities to engage with our organizations. On the next slide, you'll see in blue the blue box, that same website that we just mentioned, and then each of these boxes has ways to get in touch with each of the organizations. The ADRC by phone, email, or website, Maximus as the assessor by phone or email, or the AAA by phone or their website as well. And I think at this time, we'd like to open it up to questions, unless Megan, you want to note any final words.
No, I just thank you everyone for taking the time to be here. And yeah, we'll open for questions. I think I have a Q&A section right here. Why is this meeting so late in the day? Work ends at 5 p.m. Well, we want to ensure that families who have different needs are able to kind of maybe take off work early and be able to attend this meeting. So that's one reason we have it at 4:30, because we want to keep in mind that this just isn't for providers, but also for families and participants to better understand these processes. Is there still a plan for KDADs to train providers on MFEI? Yes, eventually all the other waivers, FE and PD, will all go to the MFEI assessment model. If SB 15 passes, some of these questions are IDD related, and I am not going to address those during this webinar due to time. I see Mary, you have your hand up. You want to come off mute and ask your question? Mary McBain, do you want to? Okay, try now. Looks like you're off mute. I can't hear you. Is it possible for you to put your question in the chat and we can get to it? We'll go on to the next person and come back to Mary. Who was the other person who had their hand up? If you want to come off mute and ask your question.
Hello, can you hear me?
Yes.
Hello, my name is Stacy, and I am an administrative case manager with a AAA. I put in a referral because, mind you, the AAA have been doing ACM and they have been the #1 sole provider of everything. So we still get a lot of phone calls. So I did a referral on 6/20/25 for a member to get on services. She did not have Medicaid. Someone finally came out to see her on 7/25. So that was more than 30 days for someone to contact her. And as of today, I still have not received the administrative case management because she doesn't have Medicaid. So we had to do the process.
Okay, I can put my email in the chat and we can take this, through email. I will say if that happened during 6/20, 7/1 is when the contract took over. So that would have been around the same time that Maximus took over the contract. So there may be some issues there between the contractors, between the AAAs coming on and Maximus coming on.
Well, we were instructed that all new referrals was to go through you guys as of 6/1, that we were unable to do new referrals. Now, if it was a reassessment, that was different, but all new referrals had to go through you guys. And that's the reason why I sent it on 6/20.
Well, as of 7, like I said, 7/1 Maximus took over. 6/1 Liberty was the ADRC. So when I guess I'm a little lost on when maybe that happened in that transition, whether that would have happened then. But we can take this. I would recommend maybe you also getting a hold of Michelle. And we've been having regular meetings with Michelle, and Michelle can address these issues because she is the contract holder of the ACM contract.
Thank you.
you have any more questions? Mary, are you able to do, how are we notified that a functional assessment is due? The assessing entity will receive a report that the assessment is due, and they will schedule the assessment when the time is due. I'm very confused over how Liberty is the ADRC. Like I said, there was a bidding process and Liberty was awarded the bid. What is program eligibility? Program eligibility means that you have been made eligible to participate in the waiver programs.
I have a question regarding the brain injury waiver assessments. I recognize I represent probably a very, very small portion of individuals on this call, but I currently am a liaison for the brain injury inpatient rehab program. And with this change in the process, we're seeing individuals that are in the acute hospital setting that need to access the brain injury program are getting a time frame of like 10 to 12 business days to get the options counseling completed before the assessment's completed. And the hospitals just cannot hold somebody for that long. So I was wondering if there was a way for that very small portion of individuals, can like they do the assessment first and then do the options counseling maybe once they're in our inpatient program, because they're not going to be going back to the community for at least, like, our average length of stay for that population is about 4.5 to 6 months. So there would be time to do the options counseling before they got back to the community. Plus, they're also working with our discharge planners to get all of the brain injury waiver services set up. So like they don't leave our facility without that.
Right. Prisca, is this something you want to address?
Hey, Megan, this is Lee. I
Sure,
can speak to that a little bit.
Oh, go ahead, Lee. Yeah.
Sorry, Prisca, I can jump in there. So yeah, we can allow exceptions. One of our specific programs is our institutional transition program, which moves people out of facility settings back into the community. You know, and we've recognized for that population, oftentimes there isn't time for the 2 steps, right? We just need to get that assessment done as quickly as possible. So if you're working with folks and you identify that the 2 steps is going to be a barrier, please reach out to us. We'll be happy to review and provide that exception so we make sure that it's not a barrier for folks getting the services they need or back into the community.
Okay, would you mind like putting in the chat who that is I need to reach out to? And is it just something that, because I'm also trying to figure out how to problem solve this, because I'm with the rehab facility and work with all the hospitals in Kansas, basically, how to get that cascaded out to hospital case managers. Like, is there one person that I should have them contact? Or it didn't used to be that we would call in the intake referral. We can, if that makes it easier communication wise. I'm just trying to figure out what the best process is, if that makes sense.
Sure. And did you say that you work specifically for brain injury, or you'd like contacts for kind of a broad range of a variety of the waivers?
For me specifically, it's strictly brain injury waiver.
Okay. I'll put Susan Sagelquist's email in the chat box there. She's our BI program manager. And yeah, if you reach out to her, she'll be happy to assist.
Oh, okay. Oh, yes. I have Susan's email. Yeah.
Okay.
Thank you.
Perfect.
Okay, Angela.
This is
yes,
Mary.
I can hear. Yeah.
Oh, good. Finally. This is creating some stress for me, I hate to tell you. Change is not easy for us old people. Is there any way that we can be notified now of the due date for the reassessment. In the past, of course, Johnson County AAA has always done this, and we get a call and we feel secure about that. But it seems like the date, it was March, then it was January, then they came out in December. So it's kind of a moving target here, and it would be helpful if Maximus could say, okay, you're on our list. This is the date that we have that you'll be hearing from us to schedule the assessment, so it's not delayed. And we know that we're on the list because I didn't even know this seminar or this webinar was going to be held. I just happenstanced upon the Facebook page. And, we are part of the portal from KDHE, and we're supposed to get information automatically via text or emails. I'm, like I say, it's creating a little stress. The other thing is the administrative case managers. My son's on the BI waiver. What if something happens to me? He's going to need, I do his administration now. How are you going to be alerted that, his DPOA, kicked the bucket and now he needs some help from the ACM? How does that happen? Okay, 2 questions. Sorry.
Well, I'm not sure if Maximus wants to address how they are reaching out to clients for reassessment.
Sure.
I can address.
Oh, go ahead.
Oh, sorry. This is Paul Cook. I'm the program director for Maximus for this particular program. We pull a list from KMIS every month, and so we are contacting people 45 days out in advance, or trying to attempt to contact them 45 days out from the due date, so that we can get it scheduled. So we've added a little extra time, more than 30 days, so that we can reach people in time, reach their POAs, make arrangements for that visit. I hope that answers your question.
Well, I don't even know if we're on your list. That's the question, because we didn't get notified about this webinar. Are we on the list? It would be nice to be notified that, hey, we're on the list, and we will be contacted.
Our database pulls your name as a waiver, or your son's name as a waiver participant, so it's automatic that it will come up for reassessment, and that's when they would reach out. So we have your information on a database, and as long as your information is up to date, Maximus will reach out for your reassessment. This webinar came through a listserv, and we put it on our Facebook page. So maybe the disconnect is maybe that you're not on the listserv. But as far as getting reassessment, I assure you, you'll be hearing from Maximus soon. Or when that comes up. And if you have any questions about that, I would also reach out to your care coordinator. They could probably help you with that date also.
Okay, well, I don't know if that helps, but yeah, I didn't even know there was a listserv, and I've been dealing with this for years, so it's kind
Can someone in KDAD? It's on our KDAD's website.
I know.
The link
Michelle.
to the KDAD's listserv. Okay.
Yeah, Michelle responded in the chat, and
Okay, great.
KDAS has done a great job, and we're really appreciative of everything they do. I guess when something changes, you get a little on edge, right?
And that's
we're so used to how it's been done, and then we go, Maximus is doing that. Well, who's that? Where are they? How are they going to know about us? That kind of thing.
Right.
So,
I hope that this helps alleviate some fears, and we're going to be in constant communication to continue to message the change as it goes out.
Because I know you have a lot of people to deal with. It's just not me out there. You got thousands of people, so I understand.
Yes. Rachel, did you have your hand up?
Yes. I was wondering if a participant doesn't know where they are in the process of getting set up with services for the first time. I know he's done his assessment, but not really sure where exactly we are. Is there a good point of contact to reach out to? Like, where should I refer him?
So if he's already been assessed, you could probably reach back out to Maximus, or they have that ask that email address, or you can contact I would say, depending on what waiver he was assessed for, maybe someone at KDADS could also help you we have a generic email that I can drop in the chat for KDADs for you to reach out to. And we can help you navigate that also. Does that help?
Thank you. Yes, that does. Thank you.
Anyone else want to come off mute and ask a question?
Hello, I think I'm gonna piggyback on Rachel's question. What if someone, you guys are saying you're doing it 45 days in advance on doing the assessments, and our consumers change phone numbers and addresses a lot. What is it that the AAA or an administrative case manager can do, because the consumers are so used to contacting us? Is there a specific point of contact number or email address that we can use when you're looking at 45 days in advance that we can call, or have the member to call?
Maximus, can you provide that information?
So let me make sure I heard you right. So you're wondering a number that a member can call so they can update their contact information. Is that what I'm hearing?
Yes. Or so you guys said you're doing your assessments 45 days in advance. So if a member remembers when they got their assessment done and they have not received their phone call yet, who can we reach out to, or give them a number for them to reach out to so they can make their contact, so they don't get overlooked and their services get canceled or closed?
Okay, thanks. So the first thing is that we're not doing the assessments 45 days out. We are starting the process, starting calling them, contacting them 45 days out. If someone wants to change their information, I believe there's a portal site that they can update their information. Is that correct, Megan? I think there's a portal site on your side. They can update the information in your system. I believe that. But if
We're dealing
not,
with a lot of senior citizens and physically disabled members. A lot of them don't understand how to work that type of
right, but they
communication and stuff like that. You know, we have to always be aware of the population that we're working with. And I'm sorry, I am most definitely I'm a clinical master's level social worker. So I am truly a social worker and I work for my people. So I'm just really trying to get a good hand on how I can help my community to the best of my ability.
And again, you can, if that's not an option, we have our email address and our phone number. I don't know if Stephanie has put it in the chat yet, but we can. They can either you can email us, or they can email us, or they can call us, and there's a number that they can call, and we will answer it and provide them with and update their information as we can. I believe they can also call Liberty to update their information, but I won't speak for Liberty. But they can easily call Maximus, and we'll be happy to update their contact information.
Okay, we have time for one more question.
I don't see the contact information in the chat.
I am adding it right now.
I have a question. Can you hear
Okay.
me? I'm with APS, and we used to have to contact KDADs for crisis exception.
Mhm.
Do we still need to do that?
Yes.
Do you know who we need to contact?
Yes, you would contact Lee Smith at this time.
Okay. Thank you.
Thank you. We will be posting these this webinar video and the slides on our KDAD's website. I will send it out, that information, when it's posted through the listserv, so you all will have that. I'll stay on the line a little bit more, so if you hadn't had a chance to get to that listserv, Lee has posted it in the chat again. Again, thank you for your time, for joining us today, so we can go through these important changes with you. I hope you all have a great evening and a great weekend. Thank you all.
Thank you. Thank you.
Thank you.